Hello everyone, myself Dr. Amit Patle. I am Radiology JR at AIIMS Bibinagar, Hyderabad. Today I am going to present a clinical case. So here is my case. 55-year-old male patient came with cheap complaints of cough with sputum since 10 days, chest pain since 1 week, 1 episode of hemoptysis 1 week back, breathlessness since 3 days. So these are the chief complaints, but there is no history of abdominal distension, no history of palpitation or syncope, no history of audible wheeze. Patient is having history of pulmonary TB 8 years back. Patient is not a known case of type 2 diabetes mellitus, hypertension, epilepsy, CAD or CVA. No history of previous surgeries. Yes, patient is ex-smoker 8 years back. He used to smoke 1 cigarette pack per day. Patient is alcoholic and drinks 90 ml per day. On examination, pulse rate, respiratory rate, BP are within the normal limit. But yes, SpO2 values we can see it is 91% with non-invasive ventilation. Patient is referred by medicine department for radiological investigation to us, and yes, we did his X-ray on dated 14 Feb 2023, and the findings are, look over here. As we can see that this is the chest X-ray, APU taken bedside, right, because patient is a bedridden. So yes, we can see here there is a bilateral hyperinflation of the lung fields. Why? Yes, because as we can see there are more than 6 anterior ribs or 10 posterior ribs above the diaphragm level on the mid clavicular line. Yes, so yes, it is a hyperinflation of the lung fields. Now we can see here in bilateral upper zones there are non-homogeneous opacities. Yeah, these are the non-homogeneous opacities. Now look over here in right upper zone, we can see that there is a fibrosis, and due to which there is pooling of the hilum. And look over here, there are multiple bilateral cavitary consolidations. So these are the findings of the chest X-ray. Now the impression is, yes, it is post-TB sequelae with reactivation and COPD. So this is our impression after chest X-ray. Now patient came for USG findings, and we did his USG, in which there are dilated hepatic veins and inferior vena cava. Portal vein is within normal limit. GB, spleen, pancreas are within normal limits. In kidney there is increased ecotexture in both kidneys, grade 1 in left and grade 2 in the right. Prostate within normal limit, and there is minimal fluid in the hepatorenal pouch. So after USG, our impression is dilated hepatic veins and IVC veins, bilateral renal parenchymal changes noted in the USG study. So our differentials in after USG and chest X-ray is, yes, the first most important DD is cough sequelae. It can be COPD, bronchiectasis or core pulmonale. Post TB sequelae with reactivation with COPD and core pulmonale. So this is the final diagnosis by the medicine department. So the reason behind this clinical case is TB, and India responsible for 1/3 of the global cases of TB. About 1.8 million new cases of TB reported every year. If we compare TB with COVID-19, so yes, there are 64 million cases till 13 November 2020, and the deaths due to COVID-19 is about 1.48 million. While if we compare this with TB, the cases is 10 million in 2019, and the deaths due to tuberculosis is 1.4 million. So yes, this is very important to discuss about this post primary pulmonary TB. So it is also known as reactivation tuberculosis or secondary tuberculosis. Now, what are the manifestations of post primary TB? So there are some few manifestations, as we classify these manifestations like parenchymal, airway disease, pleural or chest wall diseases, vascular and mediastinal. So in parenchymal, it can cause tuberculoma, thin-walled cavity, cicatrization collapse, aspergilloma, bronchogenic carcinoma. In airway disease, it may cause bronchiectasis, tracheobronchial stenosis, bronchiolithiasis. In pleural or chest wall diseases, it can cause emphysema, fibrothorax, bronchopleural fistula, pneumothorax. In vascular causes, it might cause Ramsay's aneurysm, arteritis thrombosis, dilated bronchial arteries, and in mediastinum, the TB can cause calcified lymph node, fibrosing mediastinitis, and yes, pericardial TB. So this is the table taken from the given below reference, and yes, these are the manifestations of post primary TB. Thank you so much for watching this video, and I hope you enjoyed it, and stay tuned with next clinical cases. Thank you so much.